I'm Dr. David Haase.
I'm Mary Scalf.
You
I'm
are.
a physician assistant here. And
You are, and Mary is amazing. Mary's gotten to work with me for over 3 years now.
dog 4.
Oh, 4. See, time flies when
Time
you're having fun. It's fine. And Mary is excellent. She is incredibly diligent and caring. And I just love seeing how you take care of people.
Yeah.
Yeah.
I just love being able to work here, and how I get to care for people is so different than in the previous world I came from. And this is really the way medicine has to be going forward. And I'm glad I get to be a part of it. So
Yeah.
yeah.
And we get to do it together. So our topic tonight is exciting.
It is so exciting. One might even call it hyper exciting.
Hypertension. That's right. We're going to hype hypertension tonight.
Yeah. So hypertension is otherwise known as high blood pressure. And why should we care about that?
I mean, when you said, I think we should do it on high blood pressure, I was like, oh, scratch my eyes out. Do we have to? Because is everybody else bored about hypertension? You know, it doesn't get respect. Let's just
none.
It gets
no respect.
No respect at all.
Say that.
And so as you start digging in, and we ask people, what do you want your health for? Right? What do you want your health for? And people say, well, I want to be able to like climb a mountain, or I want to be a good grandparent, or I want to do this. What's the one condition that's going to pretty much throw a huge damper into every one of those dreams that people list out of what they want?
Oh, high blood pressure and what that can cause, right? If your blood pressure is high, you can be at high risk for having a stroke. And the effects of stroke are just detrimental and to your quality of life and how you want to move forward.
Strokes are honestly, we deal with a lot of neurodegenerative disease here. We're actually just launching 2 new trials. One of them is in studying Alzheimer's disease, and we deal with a lot of folks that have neurodegenerative disease at Maxwell Clinic. And still, strokes are the thing that scare me the most, because the prevention has to be 99% of the focus.
Yeah.
We do a lot to help people recover, even with using neurofeedback and hyperbarics. And we do a lot of work with people who are recovering from strokes. But oh my gosh, so much better to not have one in the first place.
Always. And the scary thing about this topic too of high blood pressure is that you don't know it's a problem until it's a problem, but usually that problem is a stroke, or it's a heart attack, or it's like kidney issues, or you have erectile dysfunction. There's other signs to tell you later, which would be more of what we call end organ damage, that actually it's harder to, I would say, reverse that because it's already affecting other areas of the body.
Yeah, because once something's dead, it's dead.
Yeah.
And so, hypertension is a great example of a dysfunction. If we can help understand and address underlying cause of that dysfunction, while we keep that dysfunction from causing more damage,
right,
that's our ideal.
And I wanted to talk about this because I thought this was the most stressful time of the year. I'm a PA, not a singer. Sorry about that, but so literally this is a vital sign, and it tells us how is our body doing.
It's a vital sign.
Yeah,
it is a vital sign. If you just see, I'm just ashamed of my own disrespect for this. I know we treat it every day, but it's a vital.
Do you know what that means?
Exactly.
Do we know what that means? It's important. If it's not good, we're not good. So and it's known, this has been said so many times, you heard it say it's a silent killer for the reasons I mentioned before. You don't know it's bad until it's bad. So and then what struck me is that in 2018 they changed these guidelines, and the way I learned to diagnose high blood pressure in school, it tightened up a lot, and it ended up putting about 46% of our country in that category of having high blood pressure. But that didn't mean that everyone needed a medication.
So can you go, what are those thresholds now, the updated thresholds of, what is, because they've had several categories.
Yeah. So the standard that you want to be some under 120 over 80. And so the top number is known as your systolic number, and the bottom is your diastolic. And they kind of signal relaxation phases of the heart.
and when the heart is squeezing out all the blood to the rest of your body. And so before, that's kind of where you wanted to be. Before, you had these categories of like pre-hypertension and then hypertension and stage 1, stage 2. Now you just have elevated blood pressure. If you're over 120 over 80, you get to 130 over 80 and that, then you get diagnosed with hypertension.
130 over 80 now.
Yeah. And before, you could let somebody go to 140 over 90, and then you could be like, let's start medication or have that conversation. And we'll talk about a little bit later about maybe when you should consider medication though. So
Yeah, I mean, it's really amazing that it is tightened up. It just like with diabetes, right? It used to be diabetes. You didn't have diabetes till you had a fasting blood sugar over 200, and then it came to less than 140. Now it's less than 125,
25, yeah.
and we know is that your blood glucose, a fasting blood glucose, even above 100, it causes increased risk for downstream end organ damage. So, that's really, all of medicine is moving the direction. Well, we've been for quite a while.
He's been doing this for a while, and we've been going forward, but
Because we should be shooting for optimal. We should be shooting for optimal. And I think that is what it's really great to see. As a culture, as a medical community, we're tightening down the standards, because just a little bit of dysfunction long term creates a lot of potential for damage and illness.
right. We don't want to wait until symptoms come. And so this is what we're trying to recognize. But I kind of like how you started to talk about even the mention of like that the diagnosis of diabetes or high blood sugar being changed, because that is kind of one of the things you think about as a cause of having high blood pressure, is when you start, what's the precursor to getting diabetes? You develop insulin resistance, right?
Mhm.
And so and really the changer here is just how that affects like your vessel's compliance to contract and to do its job.
Yeah,
So,
I hadn't really thought of that.
like,
Sorry.
yeah.
I was just thinking about that balance. You're right, because there's insulin resistance, and then that goes to diabetes. And here we have endothelial dysfunction or glycocalyx dysfunction,
Mhm.
and that goes on to hypertension. I really hadn't been thinking of it in that linear of a term.
Yeah, and you wouldn't, we know like they're grouped together as known as like comorbidities, that they just kind of exist together sometimes, but you don't think of one as causing the other or vice versa. You just think that, people just think that high blood pressure just happens. Like you just get it. But it's a process that's ongoing due to a lot of these factors.
So let's talk about let's talk about some of those causes of high blood pressure. So it doesn't just drop out of the sky and hit you on the head.
No, it doesn't. But like, so insulin resistance, we don't want to wait till you get diabetes. You need to think about your blood sugar regulation. And so usually you want to look at getting a fasting insulin level. Your doctor, is probably not going to do that. Your functional medicine doctor will do that. So it's going to look and make sure your blood sugar is in check and that your body's responding to sugar in an appropriate way before you end up further down that way towards diabetes.
Yeah. And you really want to have a fasting blood insulin under 4.5. And that is, one of the things we're getting ready to start a big Alzheimer's, a second Alzheimer's trial, probably in about February. And one of the standards is that insulin has to get under 4.5.
That's tight.
Huh?
That's tight.
That's tight.
If you think about it, like the lab value range, they're fine until it's like up to 24 or something, right? So it's also a thing like that the lab says it's normal. We have different thoughts on that, even that we want to optimize, because we're not, again, waiting until you just get sick. So another thing, I think one of the biggest things that people don't pay attention to, and I have some patients really resist this when I see that they probably need to get this tested, but high blood pressure can be caused by sleep apnea. And sleep apnea can cause so many other things to our health if not addressed. So if you're having daytime sleepiness or snoring, if you're a little overweight, you need to get checked for sleep apnea, especially if your blood pressure is just a little bit high. Like you need to look at this now instead of waiting.
It's not as hard as it used to be.
No,
You
can do a home sleep study now. Like,
the sleep, you're right. Sleep apnea is a big deal. And then, but some other components, heavy metals. Heavy metals don't get a lot of press because Do you think there's anybody in industry that wants to talk about, the outflow of industry causing disease? There was a big pushback. I mean, I was involved in this, almost 15 years ago, and there's a lot of industries that were saying, man, let's not talk about lead and mercury because that's going to cause this huge onslaught of work compensation. So, I mean, there's a lot of, it's interesting why some people some things don't get talked about, because lead has 7 separate mechanisms by which it can elevate blood pressure. 7. And so, and what's really, interesting about that is that the people who are most affected are usually those that are about 60 years of age and above, because they were still young. Yeah, they were still young when we had lead in our gasoline and we had more lead in the paint. We did a good public health measure and changed that. And the younger people don't have anywhere near the lead burden that the older folks do.
Yeah, but we still might. And that's the thing. It's like we have to shift our perspective on like how we look at heavy metals too, because you may not have them in your blood. So when you check a blood level, it's not going to show up in blood level because it's not hiding in your blood. It's hiding in your tissues and your organs, and it contributes to your body burden. And that's in that it's going to affect that compliance and of your vessels, and cause that high blood pressure. So.
Yeah, and lead loves the kidneys. Lead loves the kidneys. Matter of fact, the chelation of lead it has a nice study published in the New England Journal of Medicine showed that long-term chelation of very low lead levels prevented kidney failure. So in the kidneys, and nobody talks about this, and nobody's reproduced the study because, well, who knows?
Convenient.
But it's there. And the kidneys are really where blood pressure is regulated by and large, because it's a filter. And if you don't have a big enough head of pressure, the filter can't work. So if the kidney says, hey, I need more pressure, it makes more pressure, even if it damages the rest of the body.
That's his priority, right? To survive. So I also think about there's simple things like nutrient deficiencies that can affect this as well. And one of the big ones I think most people know about, maybe not, is magnesium deficiency. And it can be so subtle, and there's more of an optimal level we want to get to with magnesium. But even like magnesium supplementation can help improve blood pressure. And you carry, it matters like what kind of magnesium you get with these kind of things. You can correct me on this, but I usually say magnesium oxide is the trash magnesium to my patients.
It's the butt cream.
It's the butt cream. So go ahead and take it, but like, yeah.
Magnesium oxide is sold in supplements because it is the cheapest form of magnesium you can make. You just take a magnesium and shove an oxygen on it. So it's a really tiny molecule, and you can shove a lot of it in a small pill, and it looks good on the label.
Oh yeah.
That there's a lot of magnesium, but you can't, that's magnesium that has rusted, and it's really hard to disassociate the magnesium from the oxide so that magnesium can get used in the body. You never find magnesium oxide in the foods you eat.
Right.
You should eat.
Why would you take a supplement with it?
Right.
Like,
Supplements should mimic food. That's the whole point of it.
Ideally, right? And so I would think, like, would you say the best magnesium for blood pressure, just to think about how you think about that? Would it be magnesium malate or like glycinate, chelate, or? Yeah,
this is really great. So it's always this name. You say magnesium, and then there's another word. Right. So we're contrasting for magnesium oxide, but you're right. Any of the magnesium chelates, so magnesium malate, magnesium lysine, and then magnesium threonate. We typically use magnesium threonate for the brain because it creates a high absorption through the blood-brain barrier, but it has to get into the blood in order for it to get into the brain. Exactly. So that one works wonderful too.
Yeah. So it does matter what you think about with that. So also like the easy ones here, the low-hanging fruit here on what it causes: smoking. If you're doing it, stop. That's all I gotta say about that. And then like also I'll talk about like,
we're just gonna say one more thing about smoking though, because smoking is a great delivery system for heavy metals. Arsenic and cadmium, huge amounts of there's oxidative molecules, and secondhand smoke matters here too. So just being and it's amazing how much our environment has cleaned up with regard to smoking in public places. Back when I was a boy, you would light up anywhere. And it was really,
I grew up in the time of like the smoking and non-smoking section. Yeah. So you couldn't just smoke anywhere. So at least, even though we were in the same building, there was a smoking section. So it wouldn't get to me in the non-smoking section, right?
It's amazing how few public places you can smoke now, and what a big deal that is for public health.
Yeah. So I think those are the big ones there.
Can I bring up one other one? Because you have this really cool,
no.
She's a very cool water bottle here. And you can see outdoor woman here. So this chick takes bicycles places that I get scared even thinking about.
Oh yeah.
So,
I think that actually helps to lower my blood pressure. It might in the moment when I'm scared because I'm mountain biking, that, there'll be changes, but yeah.
So exercise.
If you don't, or what about it?
If you don't exercise, so what we really try to focus on is medicine that creates health, right? How can whatever you do, are you better off long-term as a result of your actions? And if you think of it, exercise is you're giving your body a stress test, and then the body makes new and better blood vessels. It creates better cardiac output. We need that stress. And being sedentary is a direct line towards developing hypertension, because if you don't use it, you lose it.
Right. And you also think about, I'm going to just correlate this a little bit differently, but you hear that like sedentary is the new smoking, or like sitting is the new smoking, right? And so if you're sitting, you're probably not exercising either.
Yeah. So why we try to get sit, stand, desk almost all across the clinic here. We're really trying to live the message we're speaking to, because sitting is the new smoking. Any way that you can increase your activity, any small amount. There's many biometric devices that you can utilize to help track yourself, give yourself some more incentive and tracking. A big transition in my life is I made the commitment to have more active friends. And so I quit having coffee with people. I quit going and having lunch with people. If you want to meet with me, it's almost always on a walk. Let's go on a walk. Let's go on a bike ride. Let's do something active. And so we have to change our culture. Think, who is it you could invite? How could you be the hero for somebody to increase their activity? And in the same way, become, do good things for yourself.
Yeah. And that's the thing, like doing these actions will help to create other benefits to your health. And that's like what's different about what we do is that we don't give you a medication. Like you might take lisinopril for high blood pressure, but it's just going to help with your blood pressure. I mean, in the other like related conditions, but it's going to cause us side effects, and it's going to cause you to have some deficiencies and other nutrients. But if you exercise, it supports your mental health, it supports your cardiovascular health, it supports your brain health. Like it's just so many more benefits. It's like, and then sometimes I feel bad telling patients, well, take this or do this because it helped with this, and then I keep naming things. And then it seems like I'm just talking about duct tape and how it's good for everything. But it's just amazing to me. And it just all connects, so.
And it's good that you brought up lisinopril and medications, because the lisinopril is one of my favorite blood pressure medications. It's a good medication, and we use what works. Okay, we don't. People say something, well, are you a natural clinic? No, we're really just focused on what is wise and works. And getting your blood pressure down and controlling it is incredibly important. Okay, and then once we have you safe, now let's figure out what are those underlying causes and start chipping away at that, because there's stress. We didn't talk about stress as a cause, right? But the reason it's useful to maybe not only use medication, to think of high blood pressure as a medication deficiency, right? That's not really what it is, because beta blockers deplete CoQ10. The diuretics, which are water pills, they deplete your minerals. There many of the therapies can start causing another component of erosion over the course of time. And we want to do what is wise and works. And
so like if you have high blood pressure, we need to treat that. And we don't want to don't be scared to go on one. Don't be nervous about it. Because I like to say that I like to compare our vessels sometimes. This might be like not the best metaphor or like picture to go, but like I think of just rubber bands and how stretchy they are, and you can pull them, they go back, and they're pretty good and resilient, right? Well, I remember as a kid, like I'm finding a rubber band that had been left on the black pavement in the sun in the middle of the summer. And I was like, oh, this looks weird. It looked dried out. And then I tried to like stretch it and it broke. And I was like,
you killed it.
I killed it. So it's just like, it's not that your blood vessels are going to stretch and just burst like that, but it's also as we do more of this damage or unknowingly to it, it loses compliance. They become less pliable. They may stiffen up. Like it just furthers the disease process, especially if there's other things going on in the body. So
you brought up such an important point, because hypertension causes hypertension. Right.
Yeah.
The more high blood pressure you have, and I think of them like hydraulic hoses. I'm a farm boy. And so I think like if you had a self-healing hydraulic hose, but the more pressure you put through there, yours is a much better analogy. People can get it.
There's people that understand this though. I'm sure.
But I mean, if you have that, the more pressure you put through that hose, the more likely it's going to explode. But these hoses can make themselves thicker and stronger. But if you make them thicker and stronger, they have less likelihood of being able to expand and take on, have more resiliency and flexibility with regard to the pressure that has to be there.
Yeah. So it's like, if we need to do it, we need to do it. And we'll continue to work on these, because sometimes it take with some of the lifestyle changes that we'll talk about. We need to be consistent with these things, like and for about 1 to 3 months, right? And then as we see the blood pressure get better, I see it start to come down. And sometimes I don't make a big deal about it if I see a patient who's like in the upper 120s, over 80, or getting to 132, over 72 or something. I just wait and see if the magic we do works.
Yeah, because high blood pressure is one dysfunction of many. Because of some of the same causes that cause insulin resistance, that cause obesity, that cause headaches, that cause immune dysfunction, that cause, the common, the culprits in one person. These bad culprits cause high blood pressure. In this person, they cause diabetes, and but the underlying causes of disease have a lot of commonalities to them.
Right.
And that's why, but we can't, and what we do is we don't put people at danger, right? We don't want to have somebody with a raging blood pressure and not bring that down while we address underlying cause. This goes back to other doctors will often say to me, well, people don't want to change. People don't want to change. Why do you do that stuff? People don't want to change. They just want a pill.
Because most of these conditions that are lifestyle, what we learn in school, what is it? It's 3 months of lifestyle changes. Usually give them a trial of that.
It's called lifestyle changes.
Yeah.
It's for life.
Right.
It's for life. How long do I do this? Well, as long as you're alive.
It's comfortable.
Yeah. Well, that's just a mindset.
I don't like vegetables.
Yeah. How about that? And so, but that's great. Then we're getting to root cause.
Yeah.
I mean, this is why, but somebody says, I don't like vegetables. And guess what? It's going to get hard to normalize somebody whose blood pressure is elevated it down naturally if you're not going to touch a vegetable. That's going to necessarily
I can't do that
be
with fast food. I can't lower my blood pressure with fast food.
See, you would be a trouble patient. No.
Soda.
But the point, right? The point is that it is the relationship. People think, oh, it's not a pill, it's a relationship. It is walking together through a problem and being curious consistently, because no two patients are the same. I had a patient of mine I got to consult with. I've been working with for 2 years. He came in on 5 blood pressure medications.
Oh my gosh.
He is down to none.
How?
Okay. None.
That's amazing.
Right? isn't it?
That's amazing.
But there were mental, emotional components that had to be dealt with. There were physical components that had to be dealt with. There were toxic components that had to be dealt with. And it went up and it went down, and we tracked it. We used his blood pressure was so useful because it gave us an idea about where he was from the health of the body. Now, he has a lot of other symptoms, like his migraine headaches that he's been dealing with for 20 years are gone. But that both high blood pressure and migraines are symptoms of dysfunction.
Exactly.
And so we have to change our mind, and instead of glorifying them as diseases unto themselves, they are the manifestation of something that's going wrong in the body that is complex.
It's not an endpoint, right?
Mhm.
Okay, well, you have high blood pressure diagnosis, hypertension, and we just stop and we treat. But no, why? That's the name for the process. But why is it going on? And so that happens a lot in a lot of things in conventional medicine. So it's like, I like that you mentioned that, because I had a patient who we've been working on. She was at pre-diabetic, has a family history of diabetes. We've worked on, and now she's at least has a hemoglobin A1C of 5.5. She's working on fat loss. She's good with exercise. She has a low inflammatory diet, and she's been working on meditation. Her sleep is good. She has a lot of stress in her life. She's a high-powered woman, really busy, a lot of stress, and then there's past trauma. And so it's like I've watched this ebb and flow. And last time, the appointment before last, I said, next time I want to see you back in 4 weeks. I want you to track your blood pressure kind of every day until then, different times where I'm down. And I want to see you back, because I'm worried that, or I'm concerned that we need to go and start a medication then. Doc, she came back. That blood pressure was normal. It's December. It was normal as normal could be. She's been working on trauma and releasing that from her body through different types of therapy. It was just amazing and blew my mind. So it's just like that unaddressed stress or trauma on the body is so important. And one of the things I would say, we recommend different lifestyle recommendations to all our patients. It's the foundation of what we do. I'd say one of the most difficult things for people to do is to practice meditation or some kind of relaxation exercise. Would you agree?
It's definitely, it requires a shift in how they behave. Yeah. Meditation, go on. Yeah. Because you're preaching it. It is, every habit is hard until you have developed the habit.
Oh yeah.
Right. But once you develop the habit, now it's part of your life.
I think it's like also we live in a society where we wanted things done yesterday, or we want things to have an immediate feeling. And so I'll have patients that'll be like, well, I tried meditation one time and it didn't do anything. Well, it's a lifestyle change. It's for life, and it may take, we need to try to be consistent with it 1 to 3 months. And some studies show we need to do that at least like 10 to 20 minutes a day to get benefit. And there's different types of meditation that might provoke a different type of benefit. So there is so much data on this in the literature. It is so easy to just search in our glorified PubMed where we keep all this knowledge. And there's just so much. It was so interesting to read through this and just fascinating. And I will say a lot of the things that we'll talk about, it's not that it'll be this powerful as a medication, because a therapeutic dose of lisinopril is going to lower your blood pressure, at least the systolic, about 32 millimeters of mercury. And some of these, like we'll see, sometimes meditation may lower like 4 to 8 millimeters of mercury. Sometimes exercise will do about the same. Some dietary changes will do the same. But you can see that if you do the meditation, you do the exercise consistently, you do dietary changes consistently, that 4 to 8, you're getting to almost that therapeutic dose of lisinopril.
Mm-hmm. Boom. Exactly. So the idea that, and a meditation, so again, another patient I has been doing regular meditation now for 45 years.
Yeah.
And he starts every day for 20 minutes of calm, gentle breathing, being aware of his body, 5 seconds in, 5 seconds out, exercising compassion. And this individual is 82 years old now. And he has nearly clean coronary arteries and a family history of most everybody else in the family has had some type of cardiac event by 65.
Oh my goodness.
And so here he is. He has earned a healthy body. but it's an investment, right? So the idea that you create health, by snapping your fingers, by doing a whole lot at one time, y- you know, it's much more predictable to create health by investing a little bit over the long course of time. So
Yeah.
make the time to be mindful, make the time, just start with 5 minutes a day. If you just breathe in for 5 seconds in, 5 seconds out, very slowly, be aware of your body. Don't judge anything.
Yeah.
There's tons of apps that are out
Tons of
there.
apps.
What are your
I'm
favorite? What are your favorite apps?
I was gonna say, like, your Apple Watch. This is what, like, I remember when the other doctor I worked for, he got one, and like your watch would tell you to breathe, and we just laugh, like, you breathe already. No, it's a mindfulness practice, and Apple was smart to do this, but they have a mindfulness app on your watch, so do it. And it'll help time you, and it'll provoke you, it'll give you a prompt, or you'll do that deep breathing, and you can set the time, and then you can track it, how much you're doing it. So I really enjoy using Headspace. I have tried a more of a Christian meditation one called Abide. So I have patients that like the Calm app. I actually saw that there was actually a study about the Calm app in PubMed, and just the benefits and relaxation. But like, why does meditation work though? You think about what drives our blood pressure is that our nervous system, right? And we think about the autonomic nervous system and how that, if we're stressed, it puts you into that fight or flight mode. And so elevated blood pressure is just a result of that natural protective situation the body tries to do for us when we're not actually in a life-threatening situation.
Yeah, because when there is a predator coming after us, our heart rate should go up, our blood pressure should go up. We should pump a lot of extra blood. But when instead it's a social media comment, or when instead it's this idea that we have to dress a certain way, or we have to be a certain way, or we have to go to the in-laws and they have to have such an opinion, all of those rate, we call it the conserved transcriptional response to adversity. That's a big fancy,
That's a fancy term. It's a really long
biologic term. Yeah. And but it's remarkable that all mammals have this. But I want to say it's not the cause of hypertension. It is a cause.
It is.
It is a cause, because you can still have nutrient issues. You still have toxicity. You can still have, but guess what? Air is free. Air is free. And, and meditation helps with mood. It helps decrease depression. It helps lengthen telomeres. So if you want to live, you want your cells to act and be younger, regular meditation causes these caps that are on our chromosome called telomeres to grow. Yeah. And that's associated with literally not dying as young. Pretty remarkable.
Yeah. Do you want to live longer? And do you want more life in those years, Yeah. So I think I took that from you. I'm sorry.
I love it.
But
that's what I'm here for.
So because I want to try to motivate you to adapt some of these, or at least look into these for yourself and how you're going to do it at home. What do you like? I have patients that'll be like, it's just, I can't do this. I try, my mind is just so busy. I can't do meditation.
Well, it's wonderful. We actually have a couple of webinars on meditation. So I'd encourage folks to dig in and look at the longer forms that we do have, because it's so important.
And they'll address that. Yeah.
And just try. One of the most important things is failure. Failure is our friend. And the most important thing to do is to try and fail frequently, because what do we learn by not meeting our intentions? Well, that's where we grow. That is growth. And so it's not about, that oh, I failed, therefore I am bad. No, if I have failed, that means I tried, dang it. And if I've recognized it, it's like, oh, now I get to either ask myself, I can ask others, I can be curious about why this maybe didn't come through. And you may learn something way more important than what the meditation was itself.
Exactly. And I like that phrase, I get to, instead of like, I have to, different, just rephrasing the way we say things and think about things is so important for us. So I think we're good on that part. And I just want to know, like, are you exercising?
and how important exercise in reducing blood pressure. And I looked in the data and I could find stuff that even cardiovascular exercise is one of your bigger things to help reduce your blood pressure significantly. That even though isometric training can, when I think of isometric training, I think of like doing bar. Kudos to any of you who do bar. I don't like it. But it has benefits reducing your blood pressure, and strength training does as well. They're not as big as cardiovascular exercise. So how often should patients exercise for this?
Every day. Every day.
Every day.
It's not exercise. It's called be active, right?
Okay.
We're sitting here and I hate it.
I wish we
were going to do it at I almost moved it to doing it at my standing desk, so we could at least be standing while we're doing this communication.
Yeah.
And I hope that those of you out there are popping in some earbuds, walking around the house, being active.
Yeah.
And we
You don't actually need to see our faces, so
the but where can you put activity in your day? Do you have a desk job? Can you put a treadmill at that desk? We have one of the desks here has a stationary bicycle. How can you, what are other ways people can put activity into their day?
Yeah, we work on this 3rd floor of this building. I make sure I take the stairs every time. I have a lot of stuff I carry up and down those stairs when I come to work. And I like to try to take 15 minutes of my lunch break and do a walk just to get some movement in if I know I'm not going to get some other structured form of exercise. And here's the thing here. We need to think about this just as movement and yes, being active, because it's like people don't consider walking exercise, or they don't consider this movement as important. So I just don't understand. So, and what do you think about, I don't know, do you sleep well? Because sleep is important. I'll be talking about sleep apnea to address, so get that sleep study if you have symptoms, but also the quality and duration of that sleep is important. Restricted sleep was shown to show increases in blood pressure. And then also women and minorities are at higher risk for those effects. So we do need to pay attention to sleep. And I don't know how much time. I like patients to try to get somewhere between 7 to 8 hours. I want them to listen to their bodies. If they're rested after 6, then great. I need more 8 to 9. Like, I don't know.
So here's a quiz for you. What was the average amount of sleep a person in an American in the year 1900 got a night? Average sleep a night in the year 1900.
Wow.
All right, everybody, put your bets in.
Oh yeah, like ooh. So was it like 9 hours?
10 hours.
Close.
10 hours. Amazing, right? 10 hours.
No one could fathom spending that much time now.
Right.
Yeah.
And so we really are chronically underslept as a world.
Yeah.
And what changed it all? The electric light bulb. All of a sudden we didn't have to worry about, we had to harvest whale fat in order to make candles.
Think about in these devices how we always have blue light in front of our face, and that activates that.
So extending day.
Yeah.
So knowledge is your friend here, but getting to bed earlier is incredibly important. Those hours before midnight have a lot more restorative capacity to them than the hours after midnight. So, and this is where we as a culture get to make this change together.
Yeah.
We start meeting with friends in the morning and start thinking about how our noon activities, what we center our life around. So we can really kind of slow down earlier in the evening. It's profound.
It is. And I think about how that restorative sleep, it's like putting your brain through a car wash, right? It's like getting that sleep helps to clear even potential development of some of those amyloid plaques, right? That are prominent in Alzheimer's dementia. And so it's not just about your blood pressure. Well, it is, because you can also develop dementia from blood pressure issues.
Right. So microvascular injury, right? So we have a vascular type dementia. We frequently do MRIs on individuals that have memory complaints or individuals that just want to know, what can I do to make sure I'm not sliding at this moment in time. And one of my pet peeves is when we get a brain MRI on an individual and it comes back as normal, normal microvascular damage or
White matter disease. Right.
right. And it's like normal white matter disease for age. And no, there are little punctate white marks in the brain. Those are micro strokes. Those are areas where small blood vessels, we call them perforating blood vessels, have often closed up. And now there are small areas in the brain that didn't get any oxygen. And where that affects is in the deep part of the brain. You don't notice those types of strokes. But as those accumulate, an individual starts having a harder time cognating and everything gets a little harder. The person gets a little slower and they go, oh, I'm just getting older. BS. All right. BS. Your vessels are diseased and you've already lost brain. So
wait, I can't recover that brain if it's
dead brain is dead brain. So you have to start now. If you are listening to this and you're thinking about, okay, well, I'll think about this eventually. No, brain cells are very unforgiving. There's a few brain cells in the hippocampus and the olfactory bulb that we can have some new brain cells sprout, but they don't travel around the brain. They don't make all the connections of the brain cells that developed when you were young. So microvascular damage is really traumatic. I mean, I have family members that are suffering from microvascular dementia right now, and it's so sad. Because instead of like Alzheimer's dementia, where you see this decline kind of going, vascular type dementias go like, and you see these little, all of a sudden, there's a sudden new loss of function.
They're devastating.
Heartbreaking.
I've seen a friend walk through it this year and lost her mother. And it's devastating to walk through that with your parent, anybody you love.
All right. So what else can we do about this?
Oh, I don't know. How do you eat? Do you know that food affects your health? Because it's like, I meet so many people that think there's nothing wrong with what we might consume in our country. It's called the SAD diet for a reason, your standard American diet. So there's foods you want to avoid with this. And it's a lot of the things that are easy, cheap, and fast. And so those are like your heavily ultra processed foods, the things that have 10 ingredients at the store and a lot of fast food. So
yeah. And so that what class of foods? I always think of, what has the most color, right? Things like, what's brown, what's super, like cocoa is amazing. Cocoa has some benefits. The red stuff, like in grapes, grape seed extracts are amazing.
I think about blues and purples. Anthocyanins are the component in those blues and purple fruits and vegetables. And those can help lower your blood pressure. But you have to I read that you have to consume like a lot of these. Like if you want to do this by blueberries, you got to do like a cup twice a day. That seems like, and then if I do that for a month, I probably don't want blueberries anymore. Leafy greens are good for this too. But I don't know if you might turn into a blueberry if you ate that many blueberries, right?
I said that was on Willy Wonka, wasn't it?
Yeah. Well, that was a little bit.
He's just trying to
snozberries taste like snozberries.
So omega-3 fatty acids are incredibly important as well. So it's important to think about when you get omega-3 fatty acids, you get them from small cold water fish, like herring, mackerel, sardines, or because there's so many heavy metals and persistent organic pollutants in the larger fish that have omega-3 fatty acids. It's really, really sad. So this is one category where I strongly recommend nutritional supplementation, getting an omega-3 fatty acid that is very clean. There's a standard called IFOS certification, IFOS, and that certification is a third-party validation, actual testing. They take the bottle off the shelf and they say, okay, how much heavy metals, anisodines, peroxides are in this as a damaged product. And that way, you're not just, because you can kind of cheat in the nutritional supplement industry.
Oh,
You know,
yeah.
there you can kind of test the
It's
VAT.
not regulated, that the government doesn't protect us from this.
No, it is. It has. Does the government protect us from much? Okay,
That's
so
a great point.
okay, let's not. That's like, but buyer beware, right?
Right.
Buyer beware, and that's why I mean I like a system where there's freedom and there is transparency.
Yes.
So there are standards that can be utilized to say what is clean and what is potent.
And unfortunately, the fish oil that's $6 is probably not good. You think?
It's impossible for it to be okay.
Oh,
It's impossible. Yeah,
Yeah.
it just honestly is, because or it's being harvested from fish that are environmentally endangered, because sustainable harvesting of oils is really important as well. The fish oil we use most of the time is called monopure. It's harvested from very small water fish in the cold small water fish. Wait a second, small cold water fish. Apparently that was a micro stroke that just happened right there.
You okay?
I think I'm okay. Or
Face is
alert and
not
oriented times 3.
drooping. Okay.
There you go. I did have dental work this morning, so I did come
Might
in.
droop a little
I did come in
bit.
looking like I had a stroke this morning, but I am fine now. And but it's to have sustainably harvested, and when you're harvesting these almost krill-like fish, they're very small plankton and very small fish. They reproduce very quickly, and they can their populations can recover, and they don't have time for to bioconcentrate toxins. So
So clean as well. So you also can consume, I mean, you need a good quality fish oil, probably, even if you do eat fish. But I was just like, I love seeing that eating 2 sardines a day for a couple of weeks resulted in almost a 10 millimeter mercury decrease in that systolic
how many
number.
sardines?
2.
2 sardines a week or a
Yeah.
day? No, 2 sardines.
Seriously. And after 4 weeks, that showed that the blood pressure decreased. And
Yeah,
so,
and so fish have things that fish oil doesn't have. So fish have some amines in it that actually work a little bit like ACE inhibitors. So sardines, that was a great point there. Wow, I have to pull out the sardines at lunch.
yeah.
There's one physician here who's not either the two of us that likes to eat fish at dinner, and we're just putting a message out there that that's rude. So
I always bring them fish up for lunch, like every day. Like, who does that in their lunchroom? Come on. So yeah, food's important here. And there's just simple things like the more color you have to your plate, it's probably good for your body, and probably it is good for your body and probably good for your blood pressure. So lots of leafy greens, try new vegetables. Your taste can change. If your vegetable, you didn't like it cooked, I didn't like Brussels sprouts. If they're boiled, they're gross. Maybe if you like them, that's fine. Eat them that way. But I like to cook them a little bit differently. And I love Brussels sprouts.
And Brussels sprouts are great. When there was actually a study done when they're trying to figure out what are the health benefits of Brussels sprouts. And they said, okay, we're going to take these Brussels sprouts, and there's a supplement that we have called Onco Detox that's made from Brussels sprouts and broccoli seed extracts. Anyway, they looked at Brussels sprouts and they said, man, where do we find the control group? And so they just went to the hospital cafeteria and they scooped out the Brussels sprouts that were sitting in the big silver vat that had been, on the warmer there for a couple of hours. And they scooped that out and compared it to fresh Brussels sprouts, or the ones that were just steamed for a minute. And literally there was no availability of the sulforaphane molecules and such that would be beneficial for humanity in that hospital lunchroom food. I mean, it just cracks me up that they got their control for, all right, we want to test Brussels sprouts in the wild.
From the hospital cafeteria.
Exactly, in their crap.
Yeah. So you're getting fiber from Brussels sprouts if you are eating them that way, but maybe not the benefits you hope for. But yeah, so I don't know, are there any other like food comments you think here, or nutrition, or
again, everything that's things like pomegranate juice, mushrooms, garlic, seaweed, everything. Celery has natural ACE inhibitors in it as well.
Oh yeah, like if you just start eating like 4 stalks a day, it's kind of a lot of celery, but
It's not that much.
yeah, you can make it tasty. You can get like a nut butter on it.
How about just
Healthy fats.
celery?
Oh, you can just do celery. It's fine.
Sure.
It's got a nice crunch to it.
And also crunch is one of those things that we crave. Interesting. Celery is one of the things that help you get off of potato chips and other things that have a crunch value. Many people eat for the crunch, and you just have to change your mind and go like, okay, I'm going to appreciate this crunch of this very crispy vegetable. And it's astounding how many people can get off the chip wagon using celery. Yeah. I mean, actually, I prescribe it a lot as a behavior modification tool, because you want to keep having fun. You want to have mouth fun, right?
Yeah.
There's some crunch, there's some interest that's going on there. Food scientists spend a lot of time figuring out just exactly how to construct a chip so that it only crumbles under a certain number of pounds per square inch, that they measure the sound that a chip makes, how it bursts in the mouth. There's all kinds of these.
That is someone's job.
That is, oh yeah, it's called organoleptics is the field. And that's what is the science behind how to addict a human to a processed food.
That sounds unethical.
Again, transparency. We're all about it all being available, but let's have transparency and make choices, right?
See.
So.
Oh yeah, let's not outlaw anything. I don't like to demonize any food, really.
Okay, so what should people do?
I just want people I want them to monitor at home, to have that realization. And honestly, I couldn't find this standard way actually to do it in the literature. I have my preference. I don't want my patients, I don't want them to use the wrist cuffs. I haven't not read good things about them, that they're accurate. And so I want them to get an arm one. And I just ask them to take it different times a day, daily, and to see that, because your blood pressure is going to change throughout the day. And sometimes your blood pressure is going to be better than that when you're at the office. And so it's not, and also when you come to the office to get your blood pressure, do you get to sit for 5 minutes? And you're supposed to have your back against a chair, your arms to be elevated. And hopefully you just didn't exercise as you ran up the stairs for your appointment. There's so many factors that can throw it off. So the way you monitor at home is so important. And also the dream would be to help with this diagnosis is to have an ambulatory blood pressure monitor. So it can get that average of how it goes throughout the day. So that would be the dream, but I don't know. I don't know anybody does that.
I think measurement is key, right? Measurement is key.
It's data and knowledge.
It's data. And I would much rather somebody have imperfect regular measurements of their blood pressure than none.
Yeah.
So I like there's a cuff that we use in the clinic oftentimes called Omron. It's a good brand. It can be wireless. And that can be excellent at home.
It'll send the data to your phone, because normally you want the date and the time that it was checked. And so you don't have to write that down and keep up with it. So,
and twice a day is excellent. When we start doing medication titration, I think we should talk a little bit about how we come off of medications. We got a bunch of great questions that have come into us. And I think this goes to coming off of a medication. So, in order to come off of the blood pressure medication, we first of all need the blood pressure optimized. Okay. This is when we choose to do that is when we are operating from a position of strength, where we're not hoping the blood pressure goes down. No, we have that blood pressure controlled. And now we've done a great job of addressing underlying factors to the extent that we can. And then we slowly start coming off of those blood pressure medications, and we'll choose which one to come off of, usually based upon which one has the potential for causing the most problems, right? Because almost all of them have some kind of issues. How many times have we taken off a person off a medication, and now they come back and going like, oh my gosh, that blurriness that I've been complaining of for, 3 years. And we say, what blurriness? Oh, I forgot to tell you about it. But my eyes have been blurry for like 3 years and they're gone now.
The brain fog is gone now.
The brain fog is gone. So we usually go after the medications that have the most likelihood for side effects first.
Or cause kind of the more the nutrient or mineral deficiencies that we look for.
Yeah, and
in the
each
body.
person
So
that list is going to be a little
I
bit
know.
different depending upon their challenges.
what I like what you said though. You realize, did you catch what you said? You said which one you start with.
Mhm.
Meaning, like, very rarely, if you come in here, looking for help with this, you were probably not just on one blood pressure medication. And many people, to get their blood pressure controlled, are on 1, 2. Like,
Many.
I see people with at least 2 sometimes. Like, so.
And using smaller doses of more blood pressure medications may be substantially safer than using very high doses of a single medication. So the number of medications is not something people should get their skivvies in a bunch about.
Yeah.
It really is.
That's a good point.
Are you under control? Because remember, high blood pressure causes high blood pressure. The longer your blood pressure is up, the longer your blood pressure will be up. And if you have had elevated blood pressure going on for 3, 5, 10 years, you may have enough blood vessel remodeling that has occurred where we will never get that blood pressure down without the use of medications. Now, we are never going to give up. Okay. One of my characteristics is that we do not give up. But we also have to be honest with reality. And, it is what it is. Elevated blood pressure does cause additional damage long-term. So we just take it seriously because, having a stroke, having kidney failure, dialysis, all of these heart disease, heart attacks,
Blindness.
we'd rather not have to deal with those issues. So we try to pay a lot of attention to the upstream things.
Because it's something very simple. That if you're aware that your blood pressure is in that 120 to 130 or 80 or a little higher, that there's stuff that you can do now, or else it's, again, high blood pressure begets high blood pressure. It's going to be a feed forward process. It's just going to continue probably. So prevention is always the best to do, but there are things that we can implement to help improve your overall health and hopefully get you off some or all, and in the case of the patient you talked about, of those medications. Yeah.
And maybe you just do need to start eating fish at lunch and start a new trend. And so, when one of our other questions here was, being rather defensive about eating fish at lunch, and
fish for lunch is the best.
But now when we think about it, right, we're talking about changing culture, right?
Yeah.
We're talking about changing culture. We're asking be more active, have individual, have more active relationships, consider going to bed earlier, changing your party time. Just literally there's so many, party, alcohol. Oh my gosh. We didn't even mention alcohol. Alcohol is a huge cause of elevated blood pressure. And it's often in the rebound. It's often in the day or 2 or 3 after. Everybody thinks, oh, I took my drink and I took my blood pressure and it's fine. They don't get it. Alcohol is a toxin. It just is what it is. You choose to use it, then listen, it's a free country. We want to support everybody's use. We do have some tricks on how it can get metabolized faster. There's all kinds of, better living through chemistry is one of my very favorite things to do. But that being aside, alcohol is something we shouldn't forget to talk about.
Yeah. It's like, so I hope that, you'll be aware of your blood pressure and that you'll feel confident in checking it and keeping track. And I hope that you'll consider implementing exercise if you're not already, looking into meditation, prioritizing your sleep, and eating better.
And finally, just loving on yourself.
Oh yeah.
Right. This is you're enough. Right. This is your journey. Wherever you are right now is a great starting place. And restarting is something that I hope you do thousands and thousands of times in your life, because
I have to do that. I have to restart.
I
So
did it like 20 times today.
yeah.
Okay.
Yeah, it's like you are where you are, and just committing to one change, and maybe not all of these things we talked about, like that can make a huge difference for you going forward. So you don't have to do all of these at one time, but what can you do tonight, or what can you do tomorrow, and just stay consistent with that until it's a habit. It's that lifestyle change.
Mary, you're awesome.
Oh, you're pretty awesome.
Your patients adore you. You just do a great job. So thanks for starting up this new approach to podcasts and webinars. So everybody out there, thank you all for your time. Thanks for spending some time with us.
Yeah,
we had a good time. I hope you did as well.
Yeah, this is enjoyable, and I hope we gave you some information that maybe you weren't aware about. And just thanks for your time, y'all. We really appreciate it.
All right, take care.
Take care.
Bye, y'all.
Bye.